Hello, my name is Jose Rodriguez. I'm going to be presenting a case report titled A Very Rare Case of Benign Transient Hyperphosphatasemia in a Healthy Adult. So BTH is a condition that is typically seen in children. However, you can also see it in adults, rarely. It is defined as an elevation of the alkaline phosphatase up to several-fold the adult upper reference limits in the absence of any liver or bone abnormalities. Most of the patients that are found to have an isolated elevation of the alkaline phosphatase undergo extensive diagnostic investigations prior to making the diagnosis of BTH. And this happens because there is a scarce available information about adult BTH in the literature. Our case represents the 10th reported case over the last 24 years. Our patient is a 62-year-old female with no significant past medical history, only with a family history of PBC. She was seen in the clinic for a routine follow-up visit. She was incidentally found to have a significant elevation of the ALP. The review of the symptoms and the physical exam was negative. The initial ALP was 1,496 units per liter. At the time, we ordered repeat ALP in 1 week, and we also ordered lipase, TSH, T3, T4, PTH, vitamin D, an autoimmune panel, and the tumor markers, which were negative. And the ALP at 1 week was 2,100 at that time. The abdominal ultrasound, the CT with contrast of the abdomen, and the bone survey were unremarkable. The ALP was repeated again in 4 weeks, and it showed a downtrend. It was in the 1300s this time. And ALP electrophoresis showed equally elevation of the liver and bone enzymes with a typical BTH pattern. We continued to trend the ALP, and by week 6, there was a significant decrease, and by week 8, it had normalized. So the etiology of BTH is poorly understood. It is believed to be secondary to an increased sialylation of the ALP enzymes, which decreases its clearance. Most of the patients presenting with BTH are children. This condition usually coexists with respiratory or GI viral infections. When presents in adults, is usually linked to kidney transplants. Over the last 24 years, about 70% of the patients with BTH had a kidney transplant, but our patient didn't have any. So our patient also had a typical behavior of the ALP in BTH with a peak around week 2 to 4 and a normalization by week 8 to 12. Our patient, as most of the patients that are diagnosed with an isolated elevation of the ALP, are subjective to expensive and sometimes harmful diagnostic investigations. These investigations could be avoided if there were more available information of this condition. At the time that we were diagnosing our patient, we didn't find any available information about BTH on the most famous clinical resource tools available at this time. So we are concluding that this is a very rare disease. There is very little information in the literature, and we encourage the medical providers to increase the awareness of this condition. We are doing our part. We are completing a systematic literature review about this condition over the last 25 years, and we hope to expand the knowledge about this. Thank you so much.